The effort, known as the Community-Wide Children's Health Assessment and Planning Survey, or CHAPS, is the first known project of its kind in our region to focus solely on children. Necessitated by limited data, CHAPS is a monumental endeavor aiming to evaluate children's health needs, identify children's health priorities, lead local collaborations in implementing solutions, create and monitor benchmarks to measure progress, share information and resources through the Center for Children's Health, and all with the goal of improving the health of over 600,000 children ages 0 to 14 in our region.
I've been to the hospital before because I had asthma.
I knew what asthma was from my friends, but I didn't know it could do this much to you. I was real surprised.
I found that most of the children in our region, 18.1% of them, have asthma. That's 111,000 children, and that's really something that we need to look at and figure out how we can cope with it.
We did discover, and it's something I see at the school, is a level of asthma. We have a very high level of kids who suffer from asthma, and that is definitely an area that we will be looking at. I've shared this information with our school nurse, and everybody's in agreement. Yes, asthma is a problem that we really didn't recognize as being important, but when we began to compare it with other counties, we're at the high end, and it's something that we really need to take a look at.
Asthma has an economic impact on our community. Our schools are funded by the government, and when those children miss school, that takes funding away from the schools. It also affects the parents. They miss work. It increases insurance premiums and doctor's visits.
I don't have to use my asthma medication as much.
They helped me by giving me some medicine that helps my lungs.
With the education we've done of our teachers and our staff members, when a kid has asthma, I mean, he's looked at immediately.
I think there is a lot of misunderstanding about how asthma can be treated and how it can be controlled and a child can have a full, complete, normal life. But it takes a group effort. It takes the community, it takes the physicians, it takes involvement from everybody to keep these children healthy and stable.
By providing a framework needed to tackle these issues, community members have the tools and resources to initiate action. With CHAPS in place, organizations and individuals interested in acting on the data now have a comprehensive resource that's available on the CHAPS website. For more information, go to chaps.org and click on Health Issues.